everybody, welcome back to Modern Dentures. We just got this job back from the labs. This is just a quick video and I'm just going to show you how to fix this problem if it comes back. This is sort of quite a dark pinkish wax, sort of like a bright colour. It means that it's quite hard wax and a technician usually uses it to get nice detail when they're doing the try-ins. But it is very brittle, so if it takes a knock, instead of squashing, sometimes it all breaks apart like this, and this is what's happened. This is a postal one, so it's come back in the post. Obviously when it left the laboratory it was perfect, and the delivery drivers like to throw and kick stuff around, and we've all seen those videos. And so it's come back all crushed on the model. I don't know if you can see that there. Now if you touch this, it's all going to crumble, it's all going to fall apart and make a right mess. So the easy way to fix it is we just put it in the bottle warmer, about 50 degrees, 53 degrees, let it soften up, put it back on the model, and then just slowly push everything back into shape. As you can see, now it's soft, it's relatively easy to just manipulate everything back roughly where it should be. So it's just going a little bit hard again, so I'm just going to dip it. And you'll notice that the whole thing has been pushed out of shape as well, so you have to manipulate it down all the way round. And just by pushing that wax in, we should get it back roughly to where it should be. Obviously it's not, you can see those teeth have just pushed out. But once it's warmed up, you can get it more or less where it should be. And then we put the teeth into occlusion like that, and that should just help. Now, it's not perfect. I'm going to have to get a Lacron and just adjust these teeth a little bit. I'm actually looking at them, they look like they've been set too high anyway. It could be where they got squashed and I've just pushed them in, they've come a little bit high, but this is definitely too high. And there looks like there's too, when they're together, there's too much of an over bite on that, with no overjet. So I'm going to drop all those teeth down anyway. In fact, I'll do a little video of that showing you how I do it. Okay, so I find if you take all the teeth off in one go, it can make it a little bit more difficult to get them set exactly where you want them. So in this situation, I would just take off a couple of teeth at a time. Get rid of that piece of rubbish. Going back to my old trusty no flame. Right, let's try again. Just gets no. Look, I've got into the habit now of sticking my finger in there to try and get it to work, whereas you don't need to with a no flame. You can literally hold it back here and it will work instantly. Now, this job isn't articulated, which it would make it easier if it was. I've asked the lab to articulate on the same system that I use because the bite is correct and I can find the bite quite easily with the posterior teeth. It's okay that I take some of these teeth off just to locate the bite, but what we're trying to do is get these the same height. So the height of this cusp should be the same as this tooth, with just the height of the canine being slightly higher. And you can see the height of the canine on this one is just way out there. So this time I'm going to take the two front teeth off, but I'm not going to put them on. I'm going to put these two So just soften the wax. These two teeth are still stuck together, that's fine, at the same height. No, wrong two, these two are still stuck together. We'll just pop those back in, and then we'll just get that height a little bit more on the right level. We'll just check the bite again there. That looks good. These ones still look like they're set back a little bit too much. See if they fit in, so just lining them up for size. Yeah, so it's going to be a little bit of an overjet, which is fine. You can usually get away with a mil or two. And just put those into position. It's this canine here I'm not happy with, it's at the wrong angle. Sometimes you just have to put some of the other teeth in and go back to correct in the position of the other teeth, because you almost need to position them all at the same time, which is not really feasible. So you just get them on, don't worry too much about getting the position of them perfect. You just put them in so that you get in the width of the tooth. Move on to the next one, and then you shuffle them all into position. Now I'm looking at the flange on this one as well, and it's really overextended. And again, it's probably just because it's been bashed, and then where I've pushed it down onto the model, I've kind of extended it. So I just want to take a bit of that off. We don't want it right down there into those extensions. And you certainly don't want it going right over a pronounced frenum like that. And then we'll just go and take some of this off. This is too much, don't need to go into that external oblique ridge there. It's not a good area to go into too much. Normally I'd use a wax knife actually for this. Actually I can see that's overextended still on there. Just take some of that off. And then we just smooth that rough area off. And while that wax is still soft, we just need to make sure we get it on the model. You can just gently tease it in. So if we've trimmed it back a little bit too much, we can just tease it back in like that. Just adjust those teeth slightly. You could set them a lot straighter than this. Some patients want them really straight because it's what they're used to with their old dentures. I don't like to do that. I like to set them up like a little bit irregular. Just makes them look more natural, like they've grown. If they do want them to look straighter, quite often it's easier just to set them roughly like this and then just take a little bit of the tips off. I think it makes them look horrible, but it does actually make them look more like worn dentures, which is what they're used to, which is probably why they don't want that contouring and detail on the top of the tooth anyway. Looks like the bite's dropping down a little bit too heavy on that side, but we'll try it in anyway and see what it looks like when they go into lateral. But I feel like that might be a little bit low. Generally, if you're not sure, usually the teeth on the upper should be higher so that the lower teeth are higher. You move it all up so the angle of this should be more like that. This side's not too bad, but we've got a little bit of a curve going on there, which is not good. And again, it's because this tooth is set too low. It needs to be up in line. And looking at that, we've got plenty of room to bring them up, but we've got big tuberosities. That's probably why they've been set like that. Yeah, that should work. This is the upper from the lower that we just did, and I've just checked the centre line that's marked on the bite block with the model, which is there, and as you can see, it matches up with the centre line of the teeth that have been placed. However, when they're in the mouth, they look completely off, but it's not actually the centre line that's off, and this is quite common, which then you have the centre line maybe moved over by a couple of mil and then that doesn't look right. But what's actually out is down to the way that this model's been trimmed. So it's been trimmed more off this side than that side. And so, as you can see, I've actually marked the centre line there, which you can't really see it on this model too much there. But the centre line is, it comes down here, which means the teeth should be like this, but they've been set like that instead of like that. So in this sort of situation, what I would do is I would take off that first bicuspid, take off these two and that one. Sometimes I would remove both the centrals. In fact, I am going to move both the centrals. I'm going to put this one back on first, but just in a slightly better position so that it's perpendicular to that centre line there. Now this is going to move everything this way. We're going to have to move these teeth as well. The reason I'm leaving them on there at the moment is just so that I've got a guide of where I'm putting the rest of the teeth, and also if I want to just recheck the bite in the mouth, make sure that that's right. And setting this tooth, making sure it's, again, it's perpendicular to that central line. With posterior teeth, when you soften it, you just put them a little longer than they need to be, and then allow the bite to just push it in to the right position. And then when we've moved the teeth like this, just run your hot knife in. Just to seal them in position. So I've just checked it in the mouth. It looks amazing now. Just now it really looked out quite a lot. I haven't moved the teeth hardly at all. Just the angle of them, and it's made a huge difference to the overall look. Sometimes when you mark your centre line and it comes back and it doesn't look like the centre line's in the centre, check it against your bite block and what you've measured. You can even put the bite block back in the patient's mouth and just double check and see if you really did get the centre line out. If the bite block looks like it's correct in the mouth and you put it back on your model, you scratch in your centre line which is in line with the bite block and it's all lined up with the teeth, just check the angle of the teeth and make sure that they're following the ridge and they're not following the model. Because when the technician makes the try-in and they cover everything with wax, they can't see the anatomy. And it's easy to imagine, looking at the shape of this, that the centre line actually goes there, which is where they set it, rather than over here. These are really overextended, way too much. So I'm trimming these back, and you can see it on the model. You can see these sort of like rounded. This is really soft tissue that's compressed, and so you can't cover all of that. You can cover a little bit of it's okay, but you certainly can't go down to here because it's just never going to stay in. It's just going to come back as ulcers and bruising, and the denture's going to be loose and dropping down every time the patient smiles or tries to sip a cup of tea because of those overextensions. It's also ridiculously thick as well. All this wax that we've got on here, we just need to knock it right back, particularly when you've got a nice strong bone like this in that anterior region. You wouldn't want to thicken it up anymore because it's just going to push that top lip out, which doesn't look good, and reduces the functionality of the denture because the lip will also be pushing the denture down and working against it. Keep that nice and thin. I always say to my technicians, don't worry about being all fancy with the gum work at the try-in stage, but do it before you seal the denture down. Make it look really nice before you flask in it, because I always like to stick my wax knife in and mess it all up for them, which just annoys them when they've spent so long getting it all pretty looking. All this wax, all this is just excessive wax that we don't need, and all it's going to do is just add weight to the denture and fill the patient's mouth up. So again, let's just reduce this right down. It's way too big and bulky and overextended. Probably just need to tidy these up. I like to take these little bits out between the teeth as well, little bits of wax, because that always looks nicer because it just individualizes the teeth a little bit. Thanks guys, hope you found that video useful. Again, just a little insight into how I shift teeth around at a try-in stage. See you in the next one.